Hi friends, hope you are all doing well. In nowadays, many people recovering from COVID-19 have of late been afflicted by black fungus or mucormycosis. This fungus invades the sinus and makes its way into the intraorbital and intracranial regions. If its progression is not checked early, 50 to 80% of the patients could be at fatal risk. Like most of the fungi, Mucor produces millions of microscopic spherical dark-hued structures called spores, which are dispersed in air. When the spores land on moist surfaces like soil, they'll begin to germinate, producing mycelia, and they'll grow. When an immune-compromised patient inhales mucor, they may develop mucormycosis. This is a rare, non-contagious disease, but it can be debilitating or fatal if not treated quickly. When mucor attacks the sinuses, it spreads to the lungs and brain and central nervous system. Common symptoms include fever, headache, reddish and swollen skin near nose and eyes, facial pain, cough producing bloody and dark fluids, shortness of breath. It can be diagnosed through a tissue biopsy, radiograph and CT scan of the lungs. People in an extreme immune-compromised state are likely to contract this infection. Diabetologists across the country raise caution against the increased prevalence of mucormycosis during COVID-19, urging people to keep their glucose levels under check to reduce the risk. Steroids reduce inflammation in the lungs due to COVID-19 and appear to help curb some of the damage that can happen when the body's immune system fights against the virus. But they also reduce immunity and push up blood sugar levels in both diabetics and non-diabetic COVID-19 patients. For diabetes patients, this is life-threatening. A person affected with mucormycosis may need early detection and powerful diagnosis for treatment, which may in turn affect other organs such as kidneys. Prevention is extremely crucial. The way to stem the surge of the fungal infection is to make sure COVID-19 patients, both in treatment and after recovery, are administered the right dose and duration of steroids. It is also important for people with diabetes, cancer, kidney, liver diseases and organ transplant patients to keep a check on their glucose levels from time to time. The drugs most effective at treating mucormycosis are amphotericin B and posaconazole, provided the infection is found early. If it is advanced, it may eventually require surgery in which maxillary involvement and intracranial involvement is crucial. To maintain adequate systemic hydration, the treatment includes infusion of normal saline IV before infusion of amphotericin B and antifungal therapy for at least 4 to 6 weeks. How it can be prevented? One should remember that it is a rare disease. Experts advise to use double mask if you are visiting dusty construction sites. Wear shoes, long trousers, long sleeved shirts and gloves while handling soil. Maintain personal hygiene and to educate society about the disease. COVID recurring patients should be advised to remain indoors until they regain their natural strength and immunity. I hope everyone to be safe and to be responsible. Thank you.